Welcome everybody to our next session here at the Vitrolife Group Academy studio. Very exciting session now on what is the future of IVF? Where do we go? I have a beautiful panel here today that's going to talk about what we can expect in the future and share their thoughts and ideas. I'm going to pass it over to you guys to make a brief introduction and then I'll ask you some questions. Danny?
Okay. My name's Denny Sakkas. I'm Chief Scientific Officer at Boston IVF in Massachusetts and North American CSO for ESHRE Global.
And I'm Rita Vassena. I'm currently the co-founder of Fecundis, which is a company dedicated to try to improve the results of IVF cycles.
And I'm Mina Popovic. I'm the scientific director of the Eugingroup, located in, well, we're a group, but I'm based in Barcelona, Spain. And I'm a clinical embryologist originally.
Thank you. And obviously all of them with great experience in the field of IVF. So I want to ask you some questions about the future of IVF. The way I see it, there's three very important parts that could change the way we do things. And maybe, Danny, the first question for you. What do you see as the future in terms of our culture conditions, the culture media, oxygen tension, these kind of things? Are there more to be learned, more changes to be made?
Yeah, I think so, because we've been growing embryos in a very similar fashion for a long time now. We've, modified culture media, we've added amino acids, vitamins to the basic culture media we have. I think what will change is the way we culture embryos. We may use different utensils. I think microfluidics it lends itself to embryo culture, which may allow a more dynamic culture condition. Even though we're looking at one step, but I think culture conditions will change to be more dynamic through microfluidics. I think also we've always used water as the basis, so I think viscosity is something we should definitely look at. The environment in the fallopian tube is very, very different from how we do things in vitro. So I think viscosity may be something that we will look at also in the future.
If I can interrupt you there, why hasn't that changed yet?
I think it's ease of use, and I think in our own minds, we culture cells in media. It's all liquid based. It's easy to handle. Viscosity will introduce its own different challenges. But I think, again, microfluidics can handle that also in terms of how we culture things. So I think, a lot of it's things we get used to rather than things that may actually be better. So I think as embryologists, we're very comfortable sometimes in the things we do. So I think, one of the things we should look at is taking people out of that comfort zone. And that's one of the biggest challenges of introducing any new technology. It's getting people out of that comfort zone.
I don't know if you guys experience the same kind of thing when you introduce something new. It's a big step for laboratories, and I think also if you look at developments that happen, for instance, the whole add-on thing. When do you call it an add-on? When is it going to be protocol?
Yeah. Yeah, if I may add something to what Danny just said, that there is also one aspect that perhaps we have not studied enough in the past, and now with the new development in how to assay the uterine environment or the even tubal environment, the tubal fluid, there might be some ways of translating that into a composition that is, let's say, more natural or more closer to what would be the natural environment of an embryo, especially maybe around the time of implantation for culture media.
Yeah, there's certainly a lot of work that is going into testing the embryo, testing the endometrium, and creating the right culture environment. And we certainly have a long way still to go to get it right. We've come a long way already, but there's still more work to be done there. If we move on to another topic, we've seen so much changes in technology over the last few years. If you think back 20 years ago, it looked completely different inside an IVF lab to what it looks now. Rita, what is your take on technology and the implementation of technology, and what can we expect?
Yeah, so I think actually as a field we have a very important challenge, which is the challenge of access. So I would look very positively on almost everything that would allow for more access to IVF. And you can look slightly outside of the lab at things like telemonitoring or having cycles done in different conformation, part away from the clinic, part inside of the clinic. Inside the lab, I think part of access will be to streamline and standardize and make and even automate as much as possible what we do. Always, of course, assuming and hoping that this improvement that we get in terms of lower cost of doing the transfer or doing the cycle are in fact at the end translated to patients, of course. Otherwise, access will not really be improved much.
Mina, in terms of technology, it's easy to say, oh, I want this and theoretically this can work, but to actually make it work and make it a system that somebody can use in the laboratory, that's a bit challenging.
Yes,
what is your opinion on that?
Yeah, I completely agree. And as Danny was saying, I think we're very set in our ways sometimes. So actually integrating the technology and accepting it and getting embryologists and clinicians and professionals to trust the technology is also a step we have to work on. So I think it's very important to validate any technology that we're bringing in and work on. Also, as Rita was mentioning, as we automate things and we make things more accessible, to not compromise on the quality as well. And I think the validation will be very important there. So
let's take a minute about automation. There's been it's a big buzzword. What do you think about automation? What is really possible? Because it's easy to say let's automate everything, but can we? What are the low-hanging fruit in terms of automation that you think?
I think there has been some work being done already for automation. So, for instance, automation in collecting oocytes. There has been automation in ICSI. There have been papers on automated ICSI. We can automate certainly several at every step of the process. Automation in cryopreservation. We have seen even automation in a way of embryo assessment. We have now the time lapse and so on that in a way is a type of automation. So I think we will see automation at all steps during the process. It'll be important to integrate all of that, which will take I think it's a complex process, and I think we're at the start. So I think it'll take some time. But we're seeing automation in a lot of different areas.
Yeah. I think there are some steps in how we do in general in our cycle is done that are at the same time quite delicate, and at the same time they really rely on the skill of the embryologists, and therefore they're more prone to have variability in outcome. Vitrification is the typical one in which two embryologists, both highly skilled at their job, performing the same protocol, trying to do it really the same, they may have quite different results. So I think that's an area where, we have seen it, in fact, since a few years back, that it was approached by automation, perhaps not to the extent that now might be possible. That would be one area. And I think it's a little bit also, this thinking is a little bit the one that is behind the driving for trying to automate ICSI, because also there is a variability among operators there. If I were to decide what to automate, apart from making first the easy part, I would definitely look for the steps that are more variable and they require more of the embryology personal skills, so to speak, that are difficult to replicate even with training from one to the next.
I think the labs work quite efficiently, and it's interesting to always go into an IVF lab and try to automate things, but I think Rita mentioned before, one of our biggest challenges is access, and access, for more patients, because we only treat a very small majority of infertility patients. So I see automation in actually allowing more access. So, it's easy to get a treatment cycle here in Amsterdam, but 3 hours out from Amsterdam, people don't have as much access. It's even worse in America. In Asia, it's worse. So I think if we can use automation and new technologies to allow patients to do IVF where they are, rather than having to travel into a large city, that'll increase the access and the number of patients that IVF is available to, I think.
Very, very relevant point. And I think going forward from that as well is the whole way that we do IVF. We've listened to talks this morning about different ways of doing vitrification to allow for more time. Do you also see that we can change the way that we do IVF to make it more time efficient, to allow more access for patients?
For sure, the way we do IVF in terms of monitoring, we can allow more access. There's a lot of technologies out there now that allow home monitoring, even sending your sperm into a lab, which, has its own challenges in terms of tracing. But I think all these technologies will allow easier access. We saw with COVID, with telemedicine, was probably the best example that, patients, in the end, our doctors didn't like it at the beginning, but they love it now, and the patients just love that. They don't have to come in for 5-10 visits during, an IVF cycle. They can do it from their home, a lot of it. So I think a lot of that will change in the future.
Yeah, and I think in terms of automation, I think the focus will be, we will really have to go back to how we can simplify procedures. And I think that's the way that automation may also work. And that's what, as you're saying, optimizing procedures, simplifying procedures. But just to add another point in terms of technology, I think there is also a lot of application of technology for improving the patient experience as well, and that will be a big focus, I would say, for the future. So to provide patients with more information, improve the experience and optimize their experience within the clinic as well.
But what is it going to take for clinics to implement these changes? What do they need? What kind of empowerment or what examples or studies do they need to actually say, okay, let's make this change?
Well, I think technologies that involve patient experience rather than strictly clinical outcome are much easier to implement. They can be tested locally, in fact, and in fact the solution sometimes is local to a certain clinic or to a very relatively small environment. We have heard yesterday, no later than yesterday in the opening ceremony, the commentary, for instance, that women that are undergoing IVF, and if they have some caring duty already with their family, they sometimes delay rather than having, they prefer testing done at home or, some sort of monitoring from afar. And that is definitely a matter of access, and it's a matter of improving the experience, because at the end, is just one monitoring. It will not necessarily strictly affect so much the result, but definitely will improve access to treatment.
A final point I would like to make is about, and I've picked it up from all of you, is there needs to be a certain level of training and education for the people that are involved in the IVF cycle, not necessarily only the embryologists or the technicians, but for the whole staff group that will be responsible for that. What is your experience, and what do you see we can do better in terms of training and education for the clinical staff?
I think we do a fairly good job with training, but a lot of what we do is very individualised in actually the training. So I think it sort of starts from the home, basically. So I think clinics have to take more responsibility in training embryologists, I think, rather than trying to steal them from other clinics. And and it's the same with any technology. So I think the industry in itself has to take more responsibility in training, I think, especially embryologists, which is, where you come from. But we probably, I think, in Europe, there's probably more embryologists than, say, the US. It's a major problem in the US in terms of finding staff, and that becomes an issue. But I think we have to internally to change our own culture and train a bit more than we do, probably.
And I guess, to a certain extent, if we can improve the future of IVF or change it to optimize the time, it allows us for more training and education.
Yeah.
What do you think about that?
Yeah, no, absolutely. I totally agree, and I coincide with what Denny just said. And in fact, I will go one step further. And I think one of the problem or one of the issue that we are seeing, at least in Europe, but it's getting like that almost everywhere in the world, is that patients, they reach our clinics too late or very close to being too late. And perhaps it's time that we as an industry collectively think if we should perhaps not also train or at least educate our colleagues that see women way before they reach the clinic, and they can channel them perhaps more effectively so that they can get the care they need. The treatment will be probably easier and more successful if they reach, and we all, I think, gain from an improvement in this, axis of education.
Mina, your thoughts?
Yeah, I completely agree with everything that's been said, and I think in terms of implementations of new technology, also really being clear about the benefits of certain technologies, and when implementing a technology, really having the whole team participating in that, and assisting and understanding the benefits to get a technology put in place and validated, and to include as many people within the team is important.
I think in terms of the future of the technology, we've seen it for a few years now that it's here and it's here to stay. We need to embrace it and make it part of the journey, the IVF journey for the patient, to give better access, give them better treatment and better outcomes as well.
Absolutely.
Good. Listen, thank you so much. It's been a privilege talking to the three of you.
Thank you
for sharing your thoughts here today.
Thank you.